Okay, so this is video one in how Ontario healthcare works. And for this first video, I would like to address a very big topic, and it's how to find a family doctor. I've talked with a lot of friends, family, coworkers. They have a hard time finding a family doctor sometimes, and they don't know a lot of resources are available to help you out or where to even start. And some people even wonder why we have the family doctor system. So we're going to start talking about that first. So family doctors are in Canada our primary source of contact, and it's consistent. They know your medical history. They keep all of your records in one place, um, and they're your primary source of contact because if there's any issues, any questions you have in terms of healthcare, that's who you contact first. And it helps in healthcare that you have a consistent primary source of contact. It saves a lot of trouble. And having all of your records in one place is very, very useful as well. It's easier to have all of your information, and if you need to share it or get a copy of it, you just go to your doctor's office. It's also easier to request for information. For example, if your workplace needs it, if your lawyer needs it, if maybe even the hospital needs it for some treatment that you might need. Family doctors are also the ones who normally give you specialist referrals, like a cardiologist, neurologist, ear, nose, throat, anything like that. They also have access uh, to recommend or refer you to specialized clinics, programs, and a lot of these things are government sponsored or like they're reduced in price, which is really good. Like you can see a cardiologist, a neurologist by yourself, but it's not covered by the government all the time. But for example, if you were referred there by your family doctor, they would probably cover it because the doctor has a note that goes like, "Oh, this person really needs it." And then you also can get notes from your doctor, paperwork. Sometimes there's a fee, like $1 a page or something, just to cover the costs of printing and admin work. Okay, and let's go into what your family doctor can be called whenever you're talking to someone, especially in the healthcare industry. There is a lot of different terms that could be used. They can be called your family doctor, they can be called your family physician. They might just short term it and call it your doctor. Your doctor will prescribe, your doctor will recommend you, etc., etc. You, they might also be called your primary physician, primary source of contact, or primary source of healthcare contact. Now let's get into how to find family doctors. If you drive around or even search online, they'll have things like accepting new patients or accepting new patient signs nearby. I just took a picture of one um, that I was driving past. And then it's very simple. It says family doctor accepting new patients, and then it has everything that you pretty much might need, like a phone number or a contact. They also have signs outside of the clinics, and then they will say things like accepting new patients, like right on the window. Okay, and then this is some of the more bigger advertisements you would see around. And the next one is Family Doctor Database or Healthcare Connect. So this is supposed to help you find a family doctor or a nurse practitioner close to you. So we're going to go through this website a little bit. I'm not going to go through the entire thing, but just know that this is another option if you cannot find a family doctor and you want to find one. So we will be going to right, okay. Here. So this is the page you would go into once you get onto the website. And the two things you need are the healthcare number of the person that's registering and also the address. And then you'll have to go through all of this. There is a lot of questions and information. Uh, just get just go through this maybe once or twice if you need to. And so once you go through this, all of this information will be sent to the Healthcare Connect. And we're going to go through a little bit about the Healthcare Connect. So this is what you need in order to sign up with them. And keep in mind, this is all free. You don't have to pay for anything, um, just to contact them and try to find a family doctor. So as you can see, it says that priority is given to individuals who have higher health needs based on this health questionnaire. So sometimes it takes them a while to process and get to you. And once they do get to you, you'll be connected to a care connector. So these care connectors are employed by Ontario Health at Home, and they will help. They'll try their best to help connect you to family doctors in your area. If you have any requests, such as needing like a different language, which my parents prefer having someone that speaks their native language, and it helps with it helps so much when they're trying to communicate. And then when the match is found, they'll inform you and they'll work with you on that. And they'll keep on working with you until you finally find a family doctor that works with you. So this is a great option. Um, they also have by phone options. So if you don't like doing things digitally, you can call them and they will help you out. Okay, going back to other options after the going back to other options, let's say you contacted uh, Healthcare Connect and you want to also keep on looking as well. So with that, you have to keep in mind family physicians have limits on how many patients they can take and how many they can actually actively work on. So some family physicians will not take any more patients because they are completely maxed out, and you'll just have to try another clinic. Before they hit that hard lock point of they won't take any more patients, they'll start taking less patients or taking down those signs that said accepting new patients. Sometimes if you ask them or talk to them, they'll help sign you up. And then other times, they might have specific conditions where they will accept you. For example, if you're living with someone that's already going to that family doctor, then they'll possibly accept you as well because technically by then you're kind of like a family unit. You guys are living together anyways. And it's another reason we have family doctors because that way, like, if something you guys are living together, there's something that's infectious and you both get it, so it's a little bit more often to see things like that. And then you can also get a referral from someone, but the referral one usually it's not as effective as let's say if you were actually living with them for a while and you're an actual family member. That's a different story because the way I got my family doctor was initially my family doctor retired, and then my husband got a new family doctor, and then I just went and got the same family doctor that he got. So that's something you can try and do if someone already has a family doctor. Another option is to just try to go to like some walking clinics. They have some contact with some family physicians that like are new and are looking for patients. They usually have contact like that. You can just call like the walking clinics or just check, and sometimes you'll even see the signs for like accepting new patients. And also keep in mind that you might need to drive a little bit or travel a little bit for your family doctor. It's not common for you to have your family doctor like 2, 3 minutes away. That's just not not common because I know in my life I've moved around a lot, and in the past I have always had the same family doctor. So we moved all around the city, but we've always had one family doctor. And the furthest had to travel, I think it's close to an hour, was when we moved really far away. So we liked having the same family doctor. It's easier to talk to someone when you see them every once in a while and like often enough. And that's my general recommendations to get a family physician, family doctor, and hopefully this helps you out. Let me know. And yeah, I know it's I know this video isn't very polished. There's a lot of stumbling, and I probably could have said some things better, but I just wanted to get this out and hopefully help some people. And yeah,